Thank you, Dr. Vaishnavi and Sahani sir. Good evening, good afternoon, and good morning. This is the 1461st day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Stine Ruge from Denmark. We welcome all to the session and let us begin the session with 1 minute silent prayer. Thank you all. As you all know, the International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. We have 3 sessions every day. The first session of the day is already over in our Hindi session from 7:30 to 8:30. And from 8:30 to 9:30, we have our English session in the international sector. And from 9:30 to 10:30, a local language session in Malayalam. Yesterday, we celebrated our fourth anniversary day in a beautiful way. And today we begin the first day of the fourth year. So let us begin with Dr. Stine Ruge from Denmark. She is actually a physiotherapist, and she is converted to a homeopath after the birth of her first baby. And then she studied homeopathy at College of London at homeopathy. And from 2012 onwards, she has started practicing homeopathy in a beautiful way. And she is she has a specialty in her kitty, that is a homeopathy specialist in obstetrics and midwifery. That's a very important field where doctors can shine in this world, because since she is coming from Denmark, we know that Denmark is a place where very few homeopaths are practicing. Only 20 to 30 doctors are there to practice homeopathy, but still people are started using homeopathy. So definitely, the growth of homeopathy in Denmark will be a big thing that we can do in the coming years. A lot of things need to be done, because the people need to know that what is happening with the homeopathy around the world. And definitely this kind of presentation will propagate the intention of International Forum for Promoter Homeopathy is to promote homeopathy among public, because there are people who it does not know even about a word about homeopathy. So we will have to upload these videos in public in YouTube, so that the public people can watch and thereby propagation is possible. So Dr. Stine Ruge is presenting a different subject tonight, maintaining homeostasis in unnatural childbirth environment. That is childbirth environment. That is a very, very important subject. We all know that the natural childbirth is a normal thing, and only some few medicines required if at all there is some pain or something like that. But in this case, unnatural childbirth need to be looked into. So let us proudly welcome our Dr. Stine Ruge for her first presentation. Welcome, doctor.
Thank you very much. Thank you for inviting me to this presentation, and congratulations on celebrating 4 years of homeopathic talks. That is very admirable. Yeah, we are very small community of homeopaths here in Denmark. It's slowly growing. I think we are maybe less than 20 homeopaths in the country, and we all go abroad to study. Let me just share my screen.
Yes.
Okay.
Yes, everything fine. It's visible now. Yes,
fine.
You can.
Good. All right, perfect. So, my name is Stine Ruge, and As you know, I'm a homeopath practicing here in Copenhagen, where I'm located in my clinic right now. We have Copenhagen is doing a street party today, so if you hear music or any other kinds of noise, you know why. I have been trained at the Center of Homeopathic Education in London. And before I took my classical training, I was trained in homeoprophylaxis by Dr. Isaac Golden in Australia. I am specialized in homeopathy for birthing. And as the only homeopath in Denmark, I participate in childbirth all through the year. My main clients are home birthers and free birthers who wish to follow a natural path, but I also support women who choose to give birth in hospitals due to medical reasons. In this presentation, I will give examples of how I prescribe in the unnatural childbirth environment and what an unnatural childbirth environment is. All case examples are used in this presentations are from my own patients. So let's start. Okay, let's start at looking at birth prescribing. So in my opinion, birth prescribing is one of the finest disciplines of acute prescribing, and that is because we need to observe intensively and have a solid knowledge of our materia medica. As homeopaths, we rarely get the chance to observe our patients through their entire process, which is why we do follow-ups. And we often treat patients over many years while treating hundreds of other patients. I do that too. But during birth, we, as birth homeopaths, get to follow the patient from the beginning to the release, which I think is pretty amazing. A natural birth, also called a physiological birth, can, with the eye of a homeopath, be viewed like most other acute condition where the patient are showing symptoms of a strong vital force. We observe the patient's symptoms and treat according to the vital force. So, is the body working towards a natural physiological birth? Then we take a step back and let the body do what it's meant to do. If we observe stagnation or a symptom pointing away from what the body is physiologically meant to do, then we step in and prescribe in order to stimulate the vital force, just as we would in any other kind of acute prescribing, so that body again will be able to do what it's meant to do. And obviously, we also see many low vital force births, and they are treated like we homeopathically would treat any other low vital force acute condition, where we need to repeat remedies more often and where a bigger selection of remedies can be necessary. So, homeostasis, I suppose most of you or all of you already know what that is. But just to be clear, homeostasis is the ability to maintain a relatively stable internal state that persists despite changes in the outside world. So, according to birth, we could translate that into a woman is supposed to give birth without any complications, no matter where she is and what is going on around her. However, that is not what we see in the birth environment here in modern days, where complications and medical interventions are very much the new normal. and where it seems like homeostasis during childbirth is only possible for the all-natural home birthing segment. I think most people have the impression that giving birth is something that is a bit dangerous, and that's why we have medicalized birth. But it's probably, well, it is the most natural thing we can do. It is our existence. So is it the physical environment that makes all these non-homeostatic and medicalized births? No, not according to the majority of studies made on the subject. They all show very little difference in the outcome of birth happening in a classical hospital setting and in a hospital setting where it's designed like a nice hotel room. What really makes a huge difference is the behavior of the birth team. And I think most women who has given birth will agree with me that it is very, very important. I know I would rather like to give birth in a friendly and home-like environment than in a surgery kind of atmosphere. But what is definitely most important are the people around me. Yeah, so the birth team plays a huge role in maintaining homeostasis. That is what studies, statistics, and clinical experience shows us over and over again. Unfortunately, that is not very highly valued in the modern birth setting, where there is also a time schedule, and we have to get the women going to have time to take more women into the hospital. So let's look at the importance of the birth team's behavior by looking at my first case. This is a case of one of my home birthers. This is from last year. She accepted the offer of having a hospital-employed midwife come home and assist her during birth. The woman and the midwife had never met each other before, which is completely normal practice here in the Danish public healthcare system. What happened is that during active labor, the midwife continuously informs the woman that her progression is slower than how the general guideline expect her to progress. So not looking at the individual as we would always do as homeopaths, but trying to make this woman fit into the very, very small medical box. And if nothing happens soon, medical intervention will be needed, this woman is told, hinting that we should transfer her to the hospital to get things moving, even though there is no medical reason for this in this situation. The woman responds to the information with exhaustion and lack of willpower. She lays down wanting to give up, saying, "I cannot do this, I'm too exhausted." You can probably already hear what remedy she's moving into. Earlier, the midwife has told her that what she is allowed to do and what she's not allowed to do. For example, she cannot moan during contractions, which is a natural response, because it will make her too exhausted. So since she has not been allowed to follow her natural instincts, she has instead now exhausted herself. So I prescribe her gelsemium, and shortly after we see a rise in energy, we see her uterus is able to establish powerful contractions again. But then a short time later, the midwife interrupts her again, telling her time is ticking for absolutely no reason, and there is no sign of any risk still. This happens over and over again. I keep prescribing gelsemium every time the midwife discourage this woman. Eventually, the midwife leaves the birthing room to give us time to decide how long she will continue to give birth on her own terms before accepting a transfer and medical interventions. The midwife's lack of presence gives the woman a chance to actually get up on her feet, move around freely, while her husband and I pep talk her, telling her how strong, how powerful she is, and how well she is doing. Everything the midwife is actually expected to do. So with the midwife gone and a last dose of gelsemium given shortly after the baby's born, before the midwife gets back into the house. And as Dr. Gabriel Mattei would probably have commented, safety isn't the absence of threat, it's the presence of connection, which is very true in this case. Other ways that we can see how important the birth team are in the doula effect. And the doula effect is a collection of 26 studies, plus all the studies backing them up, from 17 different countries, showing the benefits of hiring a professional birth doula. And I have to say that it doesn't have to be a professional birth doula or a homeopath. It can also just be letting the birth team know how important it is to encourage the woman. But a birth doula support the family in preparing a birth which fits them and their situation. She helps in preparing a birth plan, and she's an advocate for having all the birth wishes supported, respected, and fulfilled. She is the continuum support during labor and the one they can talk to about pros and cons of every choice made during birth. The homeopathic doula will do all the same things, but she will also have treated the woman during pregnancy. She will acute prescribe during birth, and she will homeopathically support the mother and baby postpartum. If we look at the doula effect in numbers, we see a general increase in families choosing home birthing over medicalized birth. We see a 25% decrease in length of labor, a 60% decrease in use of epidural, a 40% decrease in use of synthetic oxytocin, 50% decrease in cesarean, and a 57% decrease in postpartum depression, like we also see 3 times as many women still breastfeed after 6 weeks of postpartum. I think all of this really backs up why it's so important to have support during birth. There is a very famous American midwife and home birth pioneer. Her name is Ina May Gaskin, and she has this very famous phrase saying, "If a woman doesn't look like a goddess in labor, then someone isn't treating her right." And it's probably no surprise to you that I prescribe a lot more in non-goddess-like atmospheres than in the goddess atmosphere, where the woman's integrity is respected and the homeostatic birth is encouraged and supported. In the natural and supportive environment, I usually only prescribe for physical reasons, like fetal position, hemorrhage, and to release the placenta. A lot of the times, this is not necessary if we go for the homeostatic birth, but sometimes it is. During labor, my main prescription is when the contractions are triggering old trauma, which can make it very, very difficult to stay calm and use your energy as you should during contractions. And the beauty of it, I think, is that birth is also very much able to heal all these old trauma when supported with love and calmness. But in the unnatural birthing environment, I mainly prescribe in relation to fear-mongering, lack of boundaries and respect. That is probably the most often thing people tell me when they come to see me after a birth where they haven't had any support. Discouraging, impolite, and self-esteem triggering comments, like the one from the first case, strangering entering the birthing room without warning, and other people's emotions and general fear or insecurity among the team, which is very, very common because a lot of midwives are not trained in natural childbirth being just slightly outside of the box. so a lot of them are just not experienced enough to be able to be calm in every situation. So as you can hear, a body logic and supportive birth team goes very much hand in hand with homeostasis. But interrupting homeostasis could actually be a survival instinct, because I don't believe, and I think science is backing me up here, that women are always meant to maintain homeostasis simply because we are not meant to give birth in unsafe environments. Our survival instincts prevents us from birthing where it won't be safe for our child to be born. And when this happens, adrenaline and cortisol starts fighting the oxytocin level in order to protect the mother and baby. It's a very scary situation for a young child to be born in a fearful environment. So that's why we can't give birth when we fear. And when we produce more cortisol and adrenaline than oxytocin, we become anxious. We tighten up our muscles and we try to escape the danger. This will unfortunately lead to extreme pain during contractions, which a lot of women tells us they experienced. It will lead to non-optimal fetal position, primarily because in a lot of medicalized births, women are not able to move about as freely as they would, which will also help the baby to be born. And also there is a high risk of mental, emotional, and physical trauma in the years following birth. So the allopathic solution to this is usually an epidural, synthetic oxytocin, and even more strangers entering the birthing room, wanting to make decisions on behalf of the birthing woman. This will eventually decrease the natural production of endorphins and prolactin, which will lead to even more postpartum challenges like long-lasting hemorrhage and decrease in breast milk production. So we always want to aim towards working with the good hormones, the good birthing hormones, instead of destroying them with fear and suppressive medication, because that is actually what we do. We work against the body. which leads me to the next case example of induction. So this woman, she is expecting her first child. 1 week after she has reached the due date, she is contacted by her local hospital wanting to discuss induction with her. This is very normal procedure in the Western world, especially here in Europe. Everything shows that both mother and baby are doing great. This is only a general procedure for all women past the due date. She's told that every day she doesn't go into labor, potential health risks will arise for her and her baby. However, there are absolutely no studies backing up this theory. We've had, especially here in the Northern Europe, we've had many midwives going into this and trying to make sense of this whole thing, but we see no changes in the hospital procedure. She's told that her baby will grow too big and in worst case scenario die, which is a horrible message to get as a pregnant woman. Obviously, she starts panicking, and the Braxton Hicks that she has been experiencing the last few days as an early sign of labor immediately disappear. She is now both scared of giving birth and she's scared of not giving birth. After taking aconite to calm her emotions, she starts to become very angry. We could also call this empowered. And she feels violated by the obstetricians for threatening her causelessly. I then move on to prescribe her Staphysagria. And after the first dose, she decides to grab the phone and call the hospital and say no to being induced. After ending the call, she feels so happy. She's so satisfied about taking back the control. And later the same day, she goes into labor. I have so many case examples of inducing birth where we as homeopaths can make a huge difference by just prescribing on mental emotional symptoms. So let's treat the maintaining cause. Let's remove the stone from the shoe, right? And the maintaining cause obviously is the unnatural environment. And in some cases, the maintaining cause are actually us, the people around the pregnant women and the people participating in birth. And as homeopaths, we always aim to be the unprejudiced observers, but we are only just humans, you know? And sometimes we might find ourselves in situations where we are the nervous midwife. And then obviously we need to acute prescribe for ourselves, because it's so important how we act around the woman. But first, I have an example of how I have treated a husband instead of treating his wife. I participated in a birth once where a woman's husband was doing everything he possibly could to support his wife. He did breathing exercises, he pushed, symbolized pushing, he moaned, he cheered. He was truly a very sweet and supporting husband. Unfortunately, this was overwhelming him so much that he was about to faint several times. Can you imagine that? He was using all his oxygen. He told me while he was crying that he was feeling the intense pain of every contraction in his wife's body. I prescribed him oak. And not only was he, after the remedy, able to stay calm and breathe, probably, which cured the risk of fainting, but also the woman's contractions were starting to become more manageable. His enthusiastic love and support for his wife had resulted in intensifying everything the woman felt. So now, where the remedy was given to the husband instead of the woman, she was able to truly relax between contractions. She was even able to joke and laugh, and her husband could enjoy birth without exhausting himself. So sometimes it's the people around the woman who makes the huge difference in the way they act by the homeopathic remedies. And obviously, I prescribe for myself sometimes. Some of the remedies I often use are aconite. I take that when I'm in a potentially risky situation where I need to stay calm and clear my head so I can think straight and make good decisions. Lotus, which is made from a lotus in Kerala, where I know a lot of you are from. I take that if I am being called out for birth during a time where I have a lot going on in my personal life, as all human beings experience now and then. And I need to clear my energy so I don't bring any of that private, whatever it is, into the birthing room. Sometimes I take lycopodium if I need to support my self-esteem in a situation where that has been triggered. And sometimes I also take oak for myself to avoid being like the husband who takes everything on his shoulders. Other remedies that I use quite often are cocculus, which is a great remedy for when I get called out to birth without having been able to rest before I go, meaning that I sometimes stay up for 35 hours straight. Cocculus not only helped me stay awake, stay clear, but it also helped me find my natural day rhythm afterwards. Oxytocin, the sarcodes. Sometimes I experience postpartum blues 4 to 6 days after participating in a birth, because a sudden switch between a high-level oxytocin birth and going straight out to the normal everyday life can be quite intense. When we participate in high oxytocin happenings like a birth, we will actually be able to measure a rise in oxytocin in our own blood, even though we are just the support. And the way we maintain the oxytocin level is having the newborn close to us, smell it, skin to skin contact. And obviously that is for the parents. The homeopathic doula goes home and it's a dramatic fall in oxytocin. Sometimes I also need Ignatia or Staphysagria, typically if another birth team member have treated me badly. You can probably imagine the hierarchy in a hospital setting between doctors, midwives, and the homeopaths. In those cases, I would typically have also taken phosphorus or Bercera during birth to protect my energetic space. But looking at postpartum reactions as a result of the unnatural childbirth environment, because that is the reason why a lot of women start seeing a homeopath here in this country. Many, especially first-time mothers, they are not informed what they should prepare mentally before birthing. They probably have never heard of a doula. A lot of people in Denmark have never ever heard of a homeopath, but a lot of women experiencing postpartum reactions, and quite a few of those women are then advised to contact me. So I see a lot of women seeing a homeopath for the first time in their life, right in the firestorm of a postpartum reaction. And Ignatia being my most frequently prescribed remedy for emotional birth trauma really says a lot about the birthing culture here, I think. So I have found 2 cases to demonstrate why Ignatia is as prescribed as it is. The first case is a young woman who contacts me 4 months postpartum. She hasn't been able to sleep without help from allopathic drugs since giving birth. We obviously talk a lot about her insomnia symptoms, but she keeps telling me over and over again how disappointed she is in the lack of help and support that she was hoped to get from her family, and that she's alone with her baby all day, which is not what nature intended us to be, but what is the reality of a modern world, especially in the Western world. I prescribe her Ignatia, and she's able to sleep without allopathic medication within 3 weeks of treatment. Another example is a woman with a history of hospital trauma from her first birth. She consults me due to a sudden decrease in breast milk. And we have many remedies for decrease in breast milk. But the situation here is that she has just had the absolute birth of her dreams, which has been a very healing experience from her first birth. She has chosen a free birth, meaning just her and her husband. After a few days, she decides to phone the hospital to let them know that she has given birth. The hospital midwife's responds with anger and tells her how irresponsible she is. Close to midnight the same day, 2 uniformed policemen turns up in front of her house, telling her that she has 2 choices. She can either follow them to the hospital to have her newborn checked, or get social services involved to test her ability to mother her child. She's telling me how this beautiful memory of her birth is now completely destroyed, and how this experience completely made her unable to breastfeed her child. I prescribe her Ignatia, and within 24 hours, her breast milk returned. I have been looking through a lot of my postpartum cases, and I can clearly see that the second and third most prescribed remedy is Staphysagria and opium. And from everything I've been telling you so far, you can probably imagine why those 2 remedies are often prescribed. I also prescribe a lot of lesion remedies to deal with side effects from medical interventions, like Bellis perennis, which is amazing after cesarean, Hypericum, Ipecac, Ledum, Lycopodium, Nox vomica, Phosphorus, Sabina, and sycamore seed. Sycamore seed is an amazing remedy, especially for the children who has been mechanically forced, with the head out of birth, so they experience head trauma actually from technical interventions. Here is all the references from the studies I've been mentioning. If anyone would like them, I'll be happy to send. And then I just have to say thank you for participating. If anyone is interested in contacting me, this is my info, my email, my WhatsApp, and my Instagram. So let me just go back and stop screen sharing. All right. And if anyone have any questions, comments, or anything, you're so welcome.
Thank you, Dr. Singh Ring. It's really a very good session indeed. You really shows the beauty of homeopathy during gestation, pregnancy, and even postpartum cases also. Why this medicine is not being used all over the world? That is the question. Then we need to promote all those things to among public so that public will know what is happening with homeopathy in this kind of cases. As you rightly point out, gelsemium can do a lot of wonders in those cases where the fright is the reason behind these things, and as well as the ignitia, as you know, fright, ailments after shock, ailments after sadness, ailments from fright, all those things it's a very, very good remedy. And that's the reason why it works wonderfully in all your cases. And but don't be prejudiced in those cases, because we need to think as per the patient. So sometimes even a patient in full time need pulsatilla, but some people fear that if you give pulsatilla, something wrong may happen. Never happen. If it is the right remedy, that will work. If your selection of the remedy as per the symptoms of the present condition, if you feel that it is a sepia case, you can definitely give sepia in those conditions. So that's what is homeopathy is all about. And I am inviting all of you to participate in the discussion. And Dr. Ramadevi Ambari is there. Doctor, please come out and you make your statement here, because she is an experienced person who has more than 2,000 successful infertility cases in her kitty. And she is a well-known practitioner in Kerala, along with her friend, Dr. Chanda Chandran. Both are having so much number of successful cases with homeopathy. Almost all cases were treated by the people from other side, but they were unable to get the pregnancy out of it, and then they come back to homeopathy. These people made excellent results for them. So, what's your success rate in? Have you ever tried homeopathy for infertility cases, Dr. Singh, right?
Yeah, I usually work with constitutional remedies for that. I have also worked with Liz Layla's protocol. Do you know that one? Which is especially for fertility alongside with the constitutional prescribing. It's a very interesting field.
Okay.
Ganesh, can you hear me?
Yes, we can hear you.
I was not able to attend this class, Ganesh, because one emergency case came and I had to go there, that house.
Okay.
I came here. Sorry, I was not able to hear.
No problem, but you can say something about your success rate with the homeopathy and how you manage
See,
how you manage the postpartum cases of pregnancy when there is a shock or even fright after, or sometimes there is mental dilemma for them or some kind of mental trauma for the mother. How will you manage? As far as Dr. Singh is concerned, she used to give Ignitia Vanam for them, and she gets wonderful result. That's the thing I would like to mention to you. And you can also suggest some of your prescriptions in this regard.
See, recently I had one case. Recently, not now. The baby is 4 months old. She came after 5 IVF and several IUI. Then I had given her thiocinaminum 3x. I had given her 2-3 times. I had to give because after all this treatment, the scars will be there. Then for relieving that, I had to give thiocinaminum, and I had, of course, this contraceptive medicine I have given, but she got pregnancy, and then the doctor, the same doctor, she approached, and she was telling, see how it happened. Then she told whether she was asking whether it is ICSI. No, then she told no, by a homeopathic treatment. Then the gynecologist is asking, wondering, oh, the homeopathy has got such a defect. They were telling, it seems. And she now today also one patient came. He was sending 2-3 patients here. This patient was sent by our one doctor, Dr. Sujeda, I think. He only sent this lady. We have got good medicine in homeopathy. Definitely for torch, everything. We have got medicines. For low AMH, FSH, LH, and everything. We have got medicine. Definitely. We can give them the hope. Thank you, Dr. Danesh.
Okay. Dr. Singh, what's your opinion on that?
I really appreciate the listening to everyone else's experiences. Thank you for that. It's clearly that you know, we follow the same pathways, so a lot of the same remedies are used many times.
Yeah, you are now practicing in UK or in Denmark?
I'm practicing in Denmark, but you can't train as a homeopath in Denmark, so we have to go abroad. But yeah, I practice in Denmark, and it's I must say it's very busy to be a homeopath here. So people are definitely, you know,
whether you practice all type of cases or whether you concentrate only on these kind of cases, whether you treat acute diseases.
Yeah, I see all kinds of patients, but it's very much mothers who contact me.
What about the pediatric cases, whether you touch it or not?
Yeah, I practice a lot around especially infants and babies. In a lot of the home birth or the free birth situations, I also start treating the baby right as it's born. But yeah, I think one of the best ways to promote homeopathy for people who doesn't know it is to treat their babies.
Yeah, yes, I said, once you started treating babies, definitely the family will come to you and you can treat all kind of all persons in the family with homeopathic medicines. Even whether it is a child or even a baby or even a adult or even a young girl or even a geriatric case, whatever be the case, you can manage with homeopathy. That's the beauty of that's why a homeopathic physician is known to be a multi-specialist, because we can we can go ahead with the same methodology of practice in all cases, whether it is like, for example, we used to get a lot of pediatric cases with the soon after childbirth, as well as in the milestone development stages. Particularly, there are children come up with redness in the anus with the frequent loose motion. Sometimes there may be color discrimination. There are changes, green frothy stool. In all cases, but as far as allopathy people are concerned, they may test again and again what it is. They may search what it is. But as far as we are concerned, we just look at the color of the the stool as well as then smell of the stool as well as the quantity of the stool and the frequency of stool, whether it has pain or not. All these things will differentiate each medicine, particularly Ethusa, Chamomilla. All those medicines are very, very effective in those conditions. Supposed to be particularly we can see a lot of cases coming after fever with soon after these vaccinations. In those conditions also we can treat accordingly as per we can choose the right remedy, and that will enable the patient to become back to health within 3 to 5 days. We have noted all this case because there are people, there are children who are admitted in hospitals and giving IVs for that. They are saying that we cannot manage all these things because the child is passing frequent stools and more than 20 to 30 times. But it doesn't matter. For example, if a child passes stools more than 20 to 30 times, but it's painless and the quantity is much disgusting like anything, then we can use podophyllum as the remedy in those cases. So this is the beauty, this is the differentiating point in homeopathy, and that's what we can do with it. For example, there are redness of anus. Children are brought to the clinic with the redness of anus, and we may find that some people may believe that it is you can give sulfur, but Medornum is one of the best remedy in those conditions also. Then we can also, while looking at the tongue of the patient, you can see that sometimes it may be thickly coated. And then in those cases, we can think about anti-crude and all those things. That's the beauty of homeopathy. You just look every part of the patient so that you will have to use your all sense along with the sixth sense, that is common sense. That will give you the right remedy in the shortest possible time. Within 2 to 3 minutes, some doctors, but you can see a Dr. Madhusudan Panikar is here. He is our guest of the day for the Malayalam session, but he is a very, very fine practitioner having a lot of cases, all kind of cases. He is an expert in with homeopathy, just like a legend, we can say. And that's what I would like to add. Okay, Dr. Kathy Mele is here, our friend from USA, and we can invite Doctor to say a few words on this presentation, and he can chat. Yes, ma'am. Please unmute. Please unmute. Yes.
Yes, hi. I apologize. I had to leave all of a sudden. I'm in the middle of 1,000 things. That was a beautiful presentation. And I wanted to thank Stina so much for this. It was wonderful. I was glad I was able to take it in. Can you hear me?
Yes.
Thank you, Kathy.
Yes, I just thumbs up. It was wonderful, Stina. Thank you so much.
Dr. Kathy May, I think it is a very late night in USA now.
Well, it's early morning. Well, it's almost noon here.
It's morning, early morning.
Well, it's about 11 o'clock in the morning for me.
Oh, yes, 11 o'clock, early morning, I must say. Sorry.
That's okay.
Yes. Whether you practices this kind of cases, what's your experience with Ignitia? Doctor?
I'm sorry?
What's your experience with Ignitia in those conditions?
What is my experience with Ignatia? I'm sorry, my audio is very, very bad.
Okay, no problem.
One more time. I think I've just done something that might have helped.
Okay.
What is the question one more time?
Dr. STINE RUGE has a successful rate with a very good success rate with Ignitia in those managing those conditions. What's your opinion on that, and how is your result?
What I particularly enjoyed, Stina, I love how much you emphasize how important it is for the mental and emotional. You know, having given birth myself, it's been a number of years though, but at the same time, I remember because yeah, I had allopathic doctors deliver my first two babies. My third was a midwife, and I was grateful for that. But I look at what you shared, Stina, about Ignatia, and I'm thinking, yes, yeah, if I was a midwife, if I was a doula, I would have Ignatia on hand because I can see, you know, just with what you shared, Stina, I can see how valuable.
Which potency you prefer? Whether you go with LM potencies or you go with the 1M potencies?
I would probably do, you know, because we're looking at the acute situation of birth, and it's going to be intense, and post birth, as you shared, Stina. Um, I would, you know, I guess maybe it's because I look at history so much with homeopathy and the way that I practice it. I would probably do the 200C
Okay.
situation.
That's your natural potency always. Whether you know children as well as mother parents or
Well, it's not always there's no always in what I do. It's going to depend on the situation. But I think 200C for me, I've found to be a pretty safe. Either 30C or 200C has been pretty safe for situations such as these. Safe and effective, if I can say those two words.
okay, Dr. Kathy. It's a time to wind up the session. You can say auto thanks to Dr. Stingray also.
Yes, thank you, Stina. This was absolutely fantastic, and I pray that it reached a lot of good ears because you shared so much good information, good and practical information. Thank you for what you've done.
Thank you. You're very welcome.
Anyway, it's really a very good session indeed. And we have a guest that too from Denmark, where homeopathy is just comments is it just is and it's a child. I must say it is in the childhood state. There in Denmark, we will have to make it to the big child, and then can make the homeopathy the most used medicine system of medicine in Denmark. Also, we will also give you all kind of support which needed to promote homeopathy in those areas. As you know, homeopathy is the presently the #2 position in the world. So we are trying to make homeopathy the #1 in the coming years or in the century at least. That's what I would like to add to this session. Thank you, Dr. Stingray, and those who participated, Dr. Kathy May Lame, Dr. Rama Devi Ambari, and Dr. Ram Pareso, Dr. Malsana Panikar, and those who attended the session. Thank you all. Tomorrow, and so also Dr. Abdul. It was Dr. Sri Abdul Salam who was instrumental in bringing you in this day. Thank you all once again. And over to, with that, we come to the end of the day, 1461. And tomorrow we will have a big session coming, another big session from Dr. Kavita Chandak, and she will be talking about a different subject, and that is how homeopathy saved a frustrated mother from committing suicide. That will be the subject for tomorrow. That is a typical case presentation on autism. So with that, we come to the end of the day. Thank you all. Thank you. It is the time to begin the Malayalam session. Let me think. Dr. Shaila, Dr. Mariamma, are you there? Anyway, let us begin the Malayalam session.